Welcome to Module 6, HIV/AIDS. The instructor for this module is Dr. Aditya Diti, Assistant Professor, Department of Chemistry, St. Joseph's College for Women, Visakhapatnam. Module 6, Chapter 6.3 deals with the structure, virology, and testing of HIV. The contents of this chapter are 6.3.1 deals with the structure of HIV, 6.3.2 deals with the virology of HIV, and 6.3.3 deals with the testing for HIV. The outcomes of this chapter are to understand the structure and virology of HIV, learn the testing methods that are used for the identification of HIV. Six point 3.1 Structure of HIV. Structure of HIV is spherical in shape, and you can see here the lipid envelope, MHC proteins, GP41, GP120, RNA genome, P17, matrix protein, nucleocapsid, integrase, reverse transcriptase, and the capsids, protease, peptides, host proteins are present. Lipid envelopes, etc. are present on the structure of HIV. Now we will learn the detailed description of the structure. The virus is spherical with a diameter bud on the plasma membrane. Extensive viral budding is associated with the lysis and death of CD4 cells. If the viral budding is more and more, what happens? The CD4 cells break and leads to the death of CD4 cells. The structure of HIV, it is roughly spherical with 120 nanometers in diameter. Red blood cells are nearly 60 times greater than HIV. HIV has a lipid envelope and the surface glycoprotein GP120. What is this GP? GP is nothing but the glycoprotein 120. This GP120, this numbering is given based on the molecular weight of that particular protein. And GP41 are embedded in this envelope. Here you can see the GP41 and here it is GP120. The two viral proteins are encoded by the ENV gene and are helpful in the attachment to the host cell. Below is the matrix protein P17. So P41, GP41 and GP120 are the main glycoprotein numbers which are responsible for attaching of this HIV to the host membrane. The core proteins of P24. Core proteins means which are inside the protein or which are inside the plasma membrane. The core proteins are P24 and P6. Here it is not given as they are embedded inside, so they are not marked here. The nucleocapsid protein P7, which is bound to the RNA. Here you can see the RNA. This is the RNA, and here P7 is bound to the RNA, and the above mentioned are all encoded by this viral gag gene only. The two copies of the positive viral RNA genome, protease, integrase, and reverse transcriptase enzymes lie inside the viral core. This is the viral core, and protease, RNA genome, integrase, and reverse transcriptase enzymes lie inside the viral core and are encoded by the viral gene. GP120, the surface of virus, is studded with 70 to 80 molecules of GP120 protein. The molecules appear as knob. As you see, they appear as a knob on the viral envelope. GP41 GP41, the knob are loosely connected to GP41 molecules which are embedded in the viral envelope, and P17 is the internal one. Now coming to P24, the protein molecules have been identified as making up the core of the virus. The core is thought to be complicated delta icosahedral shape. And coming to RNA, RNA is found in the core of the virus, and RT, that is nothing but reverse transcriptase, the enzyme which is vital to HIV replication, is also found in the core. Now coming to entry of HIV and lysis of CD4 cells. HIV virus infecting a CD4 T cell. This is already explained in your previous chapter even. Repeating the same again here. In the first step, receptor binding to the HIV virus, the virus binds to the CD4 receptor, and in the second step, membrane fusion occurs. What is this membrane fusion? Once bounded to the CD4 cell, a fusion occurs between the virus membrane and the cell membrane. In the third step, what happens? The HIV DNA enters the cell. Release of the HIV DNA into the CD4 cell occurs, and to the last step, DNA of the virus bonded to human DNA. That means inside the cell what has several interactions occur between the virus DNA and the cell proteins, allowing the DNA into the human DNA, allowing the DNA of the HIV virus into the human DNA virus. This is one example of how the HIV infects the CD4 cells. See, these are the virus that are surrounded to this CD4 cell, and finally this virus infects the CD4 cell. The newly synthesized virus leave the host by forming of about 110 nanometers. It contains a core surrounded by a lipid membrane derived by the post plasma membrane. The core of the HIV has 2 strands of genomic RNA and 4 core proteins of P24, P18 reverse transcriptase and endonuclear P32. Here P means protein. The name of the protein is based on the molecular weight. The lipid protein of the virus is studded with 2 glycoproteins GP120 and GP41. The surface antigen GP120 is very important for the infection and detection of AIDS. Genome and gene products of HIV. The genome contains 3 structural genes, GAG, POL and ENV respectively. These are the core proteins. Reverse transcriptase and envelope proteins. That means GAG is the core protein, POL is the reverse transcriptase and ENV is the envelope proteins. On either side of the HIV genome are long terminal repeat genes that control transcription. Besides the structural genes, it also contains regulatory genes including VIF, that is viral infecting factor gene, TAT, trans activation gene, REF, regulator of virus gene, and hunters become exposed to this infected blood. This is a diagrammatic representation of HIV, and P represents the protein with a molecular weight P18 means the molecular weight is 18,000. Now coming to the virology of HIV. AIDS is caused by retrovirus, namely human immunodeficiency virus, that is HIV, belonging to the tentivirus family. There are two forms of HIV, HIV-1 and HIV-2. Both the viruses are similar except they differ in their immunological properties. Here in this chapter, HIV-1 is described. Now coming to the natural course of AIDS in human body. That means after entering into the human body, what are the different phases that are present or that occurs in the human body? There are three distinct phases. One is acute phase, chronic phase and crisis phase. Acute phase represents initial body response to HIV infection. It is characterized by high rate of virus production which is lodged in the lymphoid tissues and the antiviral immune response of the body. This period may last for about 8 to 12 weeks. These are few symptoms of acute HIV infection: mouth sores, thrush, esophagus sores, myalgia in muscles, enlargement in the liver and spleen, nausea and vomiting, skin rashes, lymphadenopathy, malaise, headache and neuropathy. These are also few other symptoms of the acute phase. Here this is the virus that is infected and this is a CD4 cell. HIV virus infects this CD4 cell. Normally the CD4 count is from 500 to 1400 cells per cubic millimeter of the blood. At levels below 200 cells per cubic millimeter, patients become susceptible to a wide variety of opportunistic infections. When the CD4 cell count is less, what happens? You will have so many other infections. These infections: rashes, fever, swollen lymph nodes, sore throat, muscle aches, mouth ulcers, nausea, vomiting, night sweats, etc. Chronic phase. During this period, which lasts for 5 to 10 years or more, the body tries to contain the virus. Since antibodies to HIV are found in the circulation, this phase is also referred to as seropositive period. These are few symptoms of chronic HIV in men. Chronic genital ulcers, including the genital area and penis, rectal inflammation at rectum and anal area, erectile dysfunction at the genital area or penis, anal ulcers, breast tissue swelling, etc. Now coming to the crisis phase. A failure in the defense system or the body caused by the immune suppression of HIV represents the crisis phase. The plasma level of the virus is increased in this phase. CD4 T lymphocyte concentration drastically fails in this phase. Crisis phase is characterized by opportunistic infections and related clinical manifestations. Here is the summary of all the three stages at a glance. Stage 1, acute HIV infection. Approximately 2 to 4 weeks after infection, the body responds with the flu-like symptoms while trying to fight off the virus. Individuals will often not know that they are infected even though they are very contagious at this stage. And stage 2 is nothing but chronic stage. This is a time during which the virus reproduces at low levels and is seemingly dormant. The duration of this stage varies from person to person. At the end of this stage, the viral load increases. Stage 3 is the crisis phase, or otherwise known as the acquired immunodeficiency syndrome. That means this stage is otherwise termed as AIDS 1. This stage is the most severe due to the variety of opportunistic infections attacking the body. A person can survive this phase for an average of 3 years. Here it shows how the infection occurs. Stage 1 acute HIV, rapid reproduction of HIV. Some people develop flu-like symptoms. Here in the acute phase, you can see that before HIV infection, these are the CD4 cells. And coming to the acute HIV infection, these CD4 cells are surrounded by this HIV virus. And next, stage 2, which is also asymptomatic, slow reproduction of HIV and gradual reduction of CD4 cells. And in this chronic phase also, no external symptoms can be seen. So the same thing, here HIV is replicating inside the body. And stage 3, this is symptomatic, otherwise known as crisis phase. Low levels of CD4 cells in the body, appearance of opportunistic infections. That means CD4 cell count is alarmingly decreased. And finally, HIV virus cells are more and more rapidly increased, leading to AIDS. Now we shall learn about the different methods for testing this HIV virus. HIV tests for screening and diagnosis. HIV tests are very accurate, but no test can detect the virus immediately after infection. How soon a test can detect the HIV depends on the type of test being used. There are three types of HIV tests: antibody tests, antigen or antibody tests, and nucleic acid tests, otherwise known as NAT. Antibody tests look for the antibodies to HIV in a person's blood or oral fluid. Antibody tests can take 23 to 90 days to detect the HIV after exposure. Most rapid tests and the only FDA approved HIV self tests are antibody tests. In general, antibody tests that use blood from the vein can detect HIV sooner after infection than tests done with the blood from a finger stick or with oral fluid. Here, finger stick means, as we are aware of this diabetic test, rapid test. Just inserting a pin into the finger, and through that blood serum, this infection identification is nothing but finger stick identification. Antigen or antibody tests look for both HIV antibodies as well as antigens. Antibodies are produced by a person's immune system when they are exposed to viruses like HIV. Antigens are foreign substances that cause a person's immune system to activate. If a person has HIV, an antigen called P24 is produced before antibodies develop. Antigen antibody tests are recommended for testing done in labs and are common in the United States. An antigen antibody test performed by a lab on blood from a vein can usually detect HIV in 18 to 45 days after exposure. There is also a rapid antigen antibody test available that is done with a finger stick. Antigen or antibody tests done with a blood from finger stick can take 18 to 90 days after exposure. That means in order to test positive, these antigen or antibody tests take 18 to 90 days after exposure. And next, coming to the NAT, nucleic acid test. These look for the actual virus in the blood. This test should be considered for the people who have had a recent exposure or possible exposure with the early symptoms of HIV and have tested negative with an antigen antibody test. A NAT, that is nucleic acid test, can usually detect HIV from 10 to 33 days after exposure. So NAT, that is nothing but nucleic acid test, is the best method or early symptomatic method which is used to detect the HIV virus that is used. In this chapter, we have learnt about the structure of HIV, what are the different stages of HIV infection. That is, there are three distinct phases. So those three phases were learnt, and also the clinical methods for detection of HIV are also learnt. So after this, to the last chapter, we'll be learning about the symptoms, diagnosis, and abnormalities of protease inhibitor drug structures are also discussed in the next chapter. Thank you.